Action.
Okay, thank you for welcoming me to on the stage. It's a good chance for me to have been here since I started my journey back home. As I came here, I could see different environment, see different climate. Back home in my country, it's not like this. I would want to start my background as I started my educations. No, that was back in 1989 when I started my primary school. I went to Ethiopia because of the civil war in Sudan that affected many lives, and of course I was one the young man who went also across another country like in Ethiopia. That's where I seek my refuge, and from there I also started my primary education till 1990 when also people fled out from Ethiopia. I also came. See, so many disruption in primary education till 1998 now, where I supposed to also seek my for primary education. Then it was disrupted. See, till 2009 when I completed my primary leaving exams. So in 2000 sharp, I resumed my secondary education up to 2004. That's when I finished. So once again, I also proceeded to A level, which I did not complete because of the financial status. Somebody promised me, but up to then, even textbook was difficult also to buy even uniform.
Tell me about your work with the Ministry of Health.
Yes, that is very nice. My work with the Ministry of Health, my position is as a reproductive health coordinator. So I am in charge of the maternal health in the state. Previously, I was working in the hospital where I can see the pregnant mothers from Monday to Friday, but because of the work that I do, people said I also need to do managerial works. So I do monthly coordination meetings with the partners that are supporting health in Northern Pakistan state, particularly maternal and child health. So these people, we come together and share the ideas how best we can improve the maternal health in the state. For instance, seeing the indicators of the maternal and child health, how best, and then the referral system, how best we strengthen the referral system in the state, because there were maternal deaths in the state being reported each month, each day, even in an hour. So in this case, it was the task, and then also compiling the data and then send it to the central level Ministry of Health. This is what I do. I also go out to the counties and do supportive supervision. And then I also report back to my state, to my supervisor, and then this is how I've been doing.
So what are some things that have inspired you in your work to become a medical doctor?
Well, as I said before, when I've been for my secondary school, I wanted, because one of my teachers was teaching with mathematics, and then something to do with algebra, differentiation, functions. So they were calling me Dr. So, because the way he does things is so logical that I also like to adapt, and then that was good. And then now, because of the life the South Sudan is undergoing throughout the civil war, it was terrible. So it needs many doctors. So in this case, there is a need to fill the gap where human resource is critical. So in this case, I feel I should be one of the doctors who should reduce maternal deaths in South Sudan. That's why I want, because day to day I'm in contact with the patient. I see how they are dying, and because of the limited capacity that I have, I will not be able really to intervene. Maybe theoretical wise, but practically, I would not do anything. That's why I'm here.
So what do you think might be your greatest challenge being here?